obesity, the epidemic. In the US, obesity continues to be a major cause for concern. Research indicates 2/3 of the population being overweight, and while there are multiple factors that may cause the development of obesity, there is strong correlation between genetics and adverse lifestyle behaviors. In order to further determine the causal relationship between genetics and adverse lifestyle behaviors, research was conducted among various races. Statistics suggest that more than 69% of the participants agreed that genetics is the primary factor. As we continue to understand the correlation between genetics and lifestyle, concerning information linking genetics to disease, it is widely recognized that obesity is a disease rather than a health risk among individuals who are overweight. However, according to research, obesity is associated to health-related diseases such as cancer and type 2 diabetes. More evidence suggests that the combined factors of diabetes and obesity is due to environmental factors. Studies suggest that more than 60% of the adults in the US are overweight and more than one-half are obese. However, it is also recognized that hereditary may play a part in the development of obesity and diabetes. While health-related diseases are an ongoing reality, studies also indicate the correlation between genetics and various lifestyles that cause obesity. Within the past 40 years, more research was conducted with results linking genetics to environmental factors. These factors include a sedentary lifestyle, diet, and social influences. On a positive note, further research is needed to provide more information regarding treatments to include genetics and biology. The physical activity component to a healthier lifestyle is the key in preventing weight gain. Research suggests that the development of obesity is caused by increase in food intake and lack of physical activity, whereas adverse lifestyle and environmental factors are all contributing factors. The goal is to balance external factors with a balanced diet. In order to maintain a healthy weight, energy expenditure is crucial, and while physical activity is important, maintaining a consistent routine will help alleviate changes in physical activity that may contribute to the development of obesity. Further studies conclude that watching TV and all forms of entertainment is to blame for increase in BMI among children. There are psychological effects that impact obese individuals and as such may be compromised due to the continuing weight gain, in addition to the emotional aspect, which may create the desire to partake in eating, making it more acceptable. Lastly, individuals living with obesity are often stereotyped in their own society as being lazy. There are various programs available to assist overweight individuals regaining their livelihood. These programs help identify entities that increase consumption intake. These programs are self-monitoring stimulus and cognitive therapies that help reduce the urge to eat frequently. Additionally, relapse prevention programs provide social support and problem solving. Research suggests that overweight individuals suffer from social stigma and discrimination, particularly among Caucasian women, whereas specific race and gender were more sensitive to social perception. Obesity among adults and children are quite concerning and often do not recognize that they are obese, but rather thought of themselves as healthy. Research also suggests that children often blame their parents for their weight gain, removing the responsibility from themselves. Prejudice occurs in all facets in society, particularly among obese individuals. Children suffer from rejection and social stigma within their own community. Often they are classified as uneducated, as such, receiving lower grades, particularly in math and reading. Research proves that receiving health care may just be as difficult for obese individuals, whereas patient and physician are often on different levels of understanding treatment options. In cases where treatment is provided, patients felt that they were left to manage the disease on their own. The cost of medical treatments for obese patients rose from 6.31% in 2001 to 7.91% in 2015, particularly with prescription drugs due to diabetes. Moreover, a total of 9.1 expenditures in the U.S. is due to obesity. As we continue to understand current statistics regarding obesity, further studies indicate that obesity will continue to increase to 2030, whereas 83% of adult Americans living in the U.S. will become obese. In understanding the demographics, percentage increase rose among race and gender and fluctuated based on age. So far, we have covered various facets of life that are affected by obesity. Working obese adults often face challenges going to work and fulfilling their responsibilities due to health-related illnesses. These illnesses prevent obese individuals from going to work, resulting in productivity losses. According to studies conducted in Sweden, sick leave and disability was mostly used benefit, typically between the ages of 30 and 60 years old. As obesity continues to become a growing concern, further research is needed to provide additional resources with combined advocacy.